Thank you for joining us and welcome once again to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock. In this episode, we will address the new guidelines with lung cancer screening. And joining me are Dr. Adam Lye, oncologist, and Dr. Stuart Couch, radiologist with Heartland Memorial Health. Thank you both for being here today.
Thank you.
We're going to talk a little bit about some scary statistics, I think, this episode, and really how it might affect our viewers, especially those that might be tobacco users or have family members that might have smoked. As we know, smoking is linked with lung cancer. Let's talk a little bit about, I know the statistics in 2012, they were saying 160,000 deaths were related to lung cancer. How does that come home, here in Kentucky? What are our statistics, Dr. Lye?
Unfortunately, Kentucky holds the distinction of being the most cancer-prone state in the country. We rank just ahead of Mississippi in the latest statistics. And a large reason for that is because of the use of tobacco and cigarettes in our state. About 25% of our fellow Kentuckians use cigarettes and tobacco, and that's well above the national average. When you look at the causes of death from cancer, even though lung cancer isn't the most common cancer that's diagnosed, it is the most lethal. And about 90% of patients that are diagnosed with lung cancer will unfortunately pass away of their lung cancer. And that's really due to the fact that when we catch lung cancer, we're catching it usually at a very late stage, and it's much harder to cure or treat effectively at that point.
I think those are good points, and we've talked about tobacco use in other episodes of Health in the Heartland, and that actually is the single most preventable cause of lung cancer. So if you stop smoking, that does immediately reduce your risk, and actually not starting smoking tobacco. But I think you hit another good point too, because we've heard about screenings before. And a lot of the screenings that most of our viewers are familiar with, and ourselves too, are mammograms, colonoscopies for different types of cancer. And this is relatively a new type of screening for lung cancer. So Dr. Couch, why don't you talk to us a little bit about maybe the criteria for those individuals that might fall into looking into getting screened for lung cancer?
Yeah, we're looking mainly for people that are at significant elevated risk of getting lung cancer, which is people that have smoked cigarettes for some time. So the guidelines are basically those people above age 55 who have at least a 30-pack year smoking history. So 1 pack a day for a year would be 1 pack year. If somebody smoked a pack a day for 30 years, they would meet the criteria. 2 packs a day for 15 years gets us to 30-pack years as well.
So this screening, again, is not for everybody, but somebody that has been a smoker for a period of time, starting at the age of 55, correct?
Correct.
Now, again, this is not necessary. This is a newer type of a screening, and tell us a little bit about what type of screening it is. We know mammograms are a low dose type of a X-ray in a sense. What is the screening for lung cancer?
So the current screening, and to add on Dr. Couch's point, the other part of the guideline is that it's current smokers or patients that have quit smoking within 15 years. So even if you quit 5 years ago, you're still a candidate for this screening test. So the current screening, so kind of the history of lung cancer screening, unlike breast cancer and cervical cancer, some of the other screening programs that are widely accepted, really science has been looking for a good way to screen for lung cancer. Many experts have recognized for years that it's very important because it's so lethal, we need to catch it early. But it wasn't until this recent trial that looked at over 50,000 patients and showed amazing results as far as saving lives did the screening recommendation really take hold. So this is a low-dose CAT scan that is done as an outpatient procedure, very quick and very easy to perform. And Dr. Couch, I'm sure, will talk more about that. But it's the way it was studied in the trial, our patients received this test on month 0, month 12, and month 24. So they actually got 3 CAT scans within a 2-year period. The CAT scan that we deliver for this is very low dose of radiation. It's actually about 1/6 of a typical CAT scan. So even if you got all 3 of these CT scans as they did in the trial, it still is only about 1/2 the dose of radiation of a typical CAT scan. So it's actually a very good way to do it.
From a risk standpoint, the amount of radiation you get from a screening CAT scan is works out to about background radiation, the amount of radiation we're exposed to in our normal surroundings for 6 months. It's about the same amount of increased radiation as somebody in Denver who lives at a higher altitude who gets exposed to more cosmic rays because there's less atmosphere to stop it, picks up in 2 months, or the amount of increased radiation you get from taking 5 or 6 cross-country jet airplane trips. So from a risk standpoint of it causing cancer, it would be way less than 1%. Some of it is maybe as low as 1 in 2,500 from getting a cancer from a CAT scan. And any cancer that's caused by radiation is going to be, has a 20-year lag time, similar to our experience with cigarette smoking. Cigarette smoking causes cancer usually in people after they reach the age of 50 because it takes some time to work its evil. And so that's another safety factor. So the risk of the screening population, the risk of lung cancer is much, much higher than the risk of developing something from a screening CAT scan.
And I was going to ask, what's the difference between a CAT scan and an X-ray?
Yes, and the study, as Dr. Lye mentioned, involved the 3 CAT scans. The patients were randomized into 2 limbs, so half the patients received chest X-rays at the same schedule, and half of them got CAT scans. A chest X-ray, you stand in front of a cassette, and the X-rays beam through you and then gets caught on a receptor or film. In the old days it was film, and it's a 3-dimensional representation, kind of a picture of your lungs, where a CAT scan is the patient is on a couch and it slides through a donut, and you wind up with cross-sectional pictures at very thin slices to give very detailed pictures of the lungs. In years past, there have been a number of trials to detect lung cancer early. They have all used, for the most part, chest X-rays, and it just hasn't worked out. I mean, with CAT scan, you can see so much more detail, things at such a smaller size, and that's why it worked out in this case.
So you're actually getting to see more detail. What exactly are you looking for?
What we're looking for mainly are nodules, which are small masses or lumps, because cancer is an abnormal growth of tissue. You would expect it to produce that.
And then the person would get their screening X-ray. Depending upon those results, are there follow-up guidelines that are out there too?
The guidelines for follow-up, and if you look at all the people that receive a screening CT scan, you can expect that about 25% of them will have a finding that needs a follow-up. 1% of the people that are in the screening population will be found to have a diagnosed lung cancer on the screening CT scan. And about 25% will need follow-up. 75%, the remaining 75% are going to be followed up again in a year, because it's an annual screening.
Right.
And the ones that have findings that are less worrisome, that are in the short-term follow-up, will receive a CAT scan at either 3 months or 6 months, depending on what the finding is.
And granted, this is very sensitive and serious information that the patient is trying to decide if they want to participate, obviously, in the screening process. And I would assume with their healthcare professional discuss their risk factors prior to, and if they fit the category, obviously, to be screened, correct?
Correct.
Now, do they need a referral to go through the screening process, Dr. Couch?
No.
Okay, tell us a little bit about what's happening with Heart and Memorial Health and how we're doing our screening process.
The patients can refer themselves for a screening CT scan. We do review the indications for the study and the guidelines with the patients ahead of time to be sure that the patients that are presenting themselves for a screening CT scan do meet the criteria. The charge is $200. At this point, insurance does not cover that. There is some expectation, I think, that Dr. Lye may address, that with the nature of the recommendations that have come from this study, that it will at some point be reimbursed by insurance.
Tell us a little bit about the findings that we might have with the
Sure. So,
reimbursement.
right. So no one knows for sure what's
Right.
going to happen yet, but the United States Preventive Task Force is typically the organization that sets recommendations for things like screening that get picked up by Medicare, Medicaid, and then ultimately by insurance. So they have released a draft of their recommendations. It's not final, but in their draft they gave lung cancer screening, like we're discussing today, a grade of a B. Now, typically in the rules or the regulations for the government, anything that's an A or a B under the Affordable Care Act would be covered. So once this goes from a draft to being a final recommendation, assuming that nothing changes, there's a very good chance that it would be picked up by Medicare, Medicaid, and ultimately insurance.
So we'll kind of have to see in the next, I guess, cycle, and that may be next year or the following year, and I think everybody's hoping in the next year or so we'll have to see what happens. But right now that is a cash $200 out of pocket, something.
And the bottom line is the reason why we look at screening for CT scan and we look at screening for colon cancer and breast cancer is to save lives. And the numbers that came out of the study were a mortality reduction of 20%.
That's right.
Which is
phenomenal
for any screening study to reduce mortality 20%.
You have 20% risk of lung cancer death, but then overall almost a 7% risk of death from any cause, which that number is important because that's telling you that the screening procedure itself is not hurting people. So in other words, people aren't dying because of complications from the screening. It's still bringing down mortality. So if you're a smoker and you meet these criteria, this is a very important test to do because the only chance of cure for lung cancer is to catch it early.
And I think we've stressed that, you know, on Health in the Heartland previous episodes, we always talk about prevention, obviously, and the steps that you can take in minimizing your risk factors. And then again, early detection, because early detection really improves your cure rate. And finding that, then you can look at hopefully what, and it of course depends on the staging, but can help then with the treatment process. So this is something that has been very new to us in the medical field as far as finding the lung cancer screening and adding that to our list of the screenings that we have talked about before as far as
If I could add
cancer.
something too, when we talk about a 20% risk reduction, it's actually probably higher than that because this was compared, this trial, they compared CT against chest x-ray. Nobody recommends chest x-ray in the you know, day-to-day life of a primary care doctor, oncologist, et cetera. There are no organizations that recommend that. So really, the comparison is against nothing in real life. So that 20%, it's at least 20%, and it's probably higher in real world practice.
Right. We talked about tobacco as one of the risk factors, but also those individuals that might have been exposed to other chemicals, maybe through their occupations, might be individuals that could be at risk also for lung cancer, correct?
Yeah, that's right.
Okay. So it depends. You have to really look at your personal history, talk to maybe your healthcare professional about what your personal risk factors are. What about family members? Is that a risk factor as far as secondhand smoke right now or no?
So secondhand smoke is a risk factor for lung cancer. It's not as high of a risk factor as using tobacco products personally. The other thing is that there is some type of family risk as well. Everybody knows somebody who got lung cancer in their 50s, 40s even, very early. But then everyone also knows somebody who smoked 3 packs of cigarettes for their whole life and died when they were 90. So clearly there is some type of genetic trigger or component in there that some families or family members are just more at risk of developing a lung cancer. So that is one thing that you should discuss with your doctor, that you may want to consider screening even earlier, and these guidelines allow for that. If you have a lot of risk factors, you could actually even do it before the age of 55, although that's not the typical pattern.
And I would encourage that. Most people in the risk group are going to be seeing a physician regularly, one would hope.
Sure.
And that's the time to bring this conversation up. I mean, it's fine to look into it at Heartland Memorial and to talk about doing it, but really, anytime you enroll in a screening program, it involves a commitment to that because, like I said, 25% of those people are going to have something that needs some type of follow-up. And then the question is, when do you screen again? And so the place to really start some of those conversations would be with your doctor, and make sure it's the right thing to do.
What about those individuals that might have an underlying lung disease such as COPD or emphysema?
So that's a risk factor for developing lung cancer. This is all about the lung and the tissue's exposure to inflammation and damage. So we know that the duration of cigarette use is 10-fold to 100-fold more important than the quantity of cigarettes used. So for instance, somebody that smokes a quarter pack of cigarettes a day for 30 years is much more at risk of somebody that smokes 3 packs per day for 10 years. It's that long duration of exposure, and that's what also causes COPD and emphysema. So for that reason, those patient groups are both at risk of developing a lung cancer.
And we want to stress too that the screening is not a substitution for smoking cessation or a substitute or a gateway to that it's okay to do that. This is there for those individuals to look at that early detection, hopefully look at some of their habits that they might have too if they have been exposed to different things or are exposing themselves to frequent tobacco use still.
Right.
So not again a substitution, but it is there as a tool to look at possibly making some lifestyle changes and hopefully not having to have any treatment, but following up from there.
That's right, and I think one thing that we didn't touch on yet is that the other important part of this trial is that these were patients that were asymptomatic. They had no complaints. They didn't have a cough. They weren't losing weight. They weren't coughing up blood. You know, those are things that I see as the lung cancer is already advanced. So the important thing is to do this when you're feeling like your normal self and catch it early. But I think you made a good point. It's no substitute for smoking cessation, which is really the best treatment for this.
And not starting.
Right, and not starting, of course.
And not starting, so we know that that is there. So Dr. Couch, I want to go back to Heartland Memorial Health has just started offering this to our community. And so they can have self-referrals, is that correct, to have the lung screening. How would they go about that? They call to make an appointment and request it, is that correct?
That's correct.
Okay.
And currently we're doing it through Elizabethtown Diagnostic Imaging.
Right.
So you can pick up the phone, and it's 982-3344,
Right.
and just pick up the phone and call, and that's really it.
Exactly, yeah, and then of course the self-pay. That's the
Correct,
other thing
yes.
too. Just know up front that it is
The
a
charge
self-pay.
is $200,
Right.
and
Which is, I think that's a bargain.
well, to learn. And you know, the other thing there too is maybe before picking up that phone, thinking about your personal health risk factors, possibly talking to your personal health care provider too and understanding. And then those results are then, of course, you know, shared that way because there is some potential follow-up. So
there
you want to
is,
be
and
prepared for that.
Exactly.
You definitely want to be prepared for that.
And it's one of these. Anytime you do that, there's fallout from these things, and you want to be aware of where that lies. And that does include. Then it's a global fee, so that frequently comes up. That includes that's the whole beginning and end of it.
Right. That's the reading and also the screening,
Everything.
Which again, as Dr. Lye was saying, is the bargain price for
in
a
today's
small
healthcare,
screening. Yes, it really is. But again, we want to stress that these guidelines were studied over a period of time. American Cancer Society, American Lung Association, I believe, and you said the U.S. Preventive Services Task Force. Is that correct? Everybody kind of came together.
NCCN,
National,
all the major committees and organizations are recommending it.
Yeah, and at the risk of getting into something that's complicated, and you can edit it out if you want. At the risk of getting into something that's complicated, screening for lung cancer has been tried for decades, since there were studies in the 1960s, large studies that were done trying to detect lung cancer early with chest x-rays. Again, the goal being not so much to detect lung cancer early, but to impact mortality, and it never has worked out. And the study was designed using both chest x-ray, which is the standard for a test that we know really doesn't work, with something that may work, which is CT, but combined with the CT was new understanding, I think, of what things mean on a CAT scan. By the time people are above the age of 50, certainly if they lived in the Mississippi Valley, there's a lot of things on their chest x-rays that are not normal, but they're not cancer. And how you pick out early cancers and what to follow out of things that are not, figuring out what was important and what wasn't important, I think was a real learning curve in this, what we should follow, what we didn't need to follow. That's where the real improvement was made in really understanding the disease a little better, the manifestations of it on the CAT scan.
Really key. Well, I appreciate both of you being here with us to share this information, and hopefully our viewers will take the opportunity to, think about your personal health risk factors. Again, talk to your healthcare professional about those risk factors. If you are interested in looking at the self-referral to the lung screening, you can call the Elizabethtown Diagnostic Imaging Center, which is part of Heart and Memorial Health. We'll have the number here up for you on the screen. We thank you for joining us this episode, and hope you tune in next month for another important edition of Health in the Heartland.